trainers are not born. It's not in your personality. So it must be something you achieve.
There are tensions between training a young surgeon and having a service that depends upon those young surgeons to provide that service. There is a tension there.
But without good trainers, you can't mould a trainee into the right shape.
We assume that once we graduate, when we become consultants, we've made it. We are educators, and we're perfect practitioners, and we're great communicators, and that's very far from the truth. In fact, this journey never stops. We need to continue to improve ourselves as communicators and as practitioners, but also as educators.
So the concept is we need to understand errors, we need to analyze them and study them and be open and transparent about it, and then use them to create better educational interventions.
And the evidence would suggest that the majority of teaching in professionalism comes from our mentors, from the people that have trained us. We model ourselves on behaviours we've seen before.
There's a lot of changes, going on with junior contracts, junior training, and it's good to know what's being done.
The days where everyone is a trainer by default, I think, are over. But I think those of us who want to remain as trainers need to be regularly trained to do it and regularly assessed to do it probably as well.
Assessment is about putting your best foot forward, whereas learning is actually about being fallible and exploring ways to improve.
And this ad hoc arrangement of giving education in the workplace has come about largely because we think we're all trainers as soon as we become consultants.
We need to have an environment where there's a sense of clinical momentum with enthusiastic leadership. And most importantly, there's a genuine commitment to training.
You can be a good academic, you can be a good trainer, you can be a good clinician, but you don't need to be all three. Be available, be approachable, be consistent, be patient, make time.
And I think it's great being with people who are generally cleverer, faster, sharper, and hungrier than me.
There is inadequate time for training, not only for trainees, but also for trainers. Trusts do not give enough time for trainers to do the job properly.
It's really what we all aspire to be doing as surgical trainers. We want to be able to have that special skill of taking our trainees from the kind of learner-driver stage and taking them to the confident, safe, independent practitioner.
That ability to install a degree of judgment that is reliant upon not just skill but knowledge and aptitude.
And Carlos again spoke about something called strategic mindfulness, and what he did was he took a group of medical students and he quizzed them whilst they were doing a task which was putting in a cannula, and he said, what are you thinking about? And he associated people who were strategic thinkers, such as I'm keeping the needle at 45 degrees and making sure the bevel is up before inserting it, with a good outcome, with a positive outcome of completion.
Investing in education will impact performance, and performance will impact clinical outcomes and clinical costs. Who will administer it? Who will pay for it? It obviously needs to be accepted by our profession. It has to come from within our profession. And the toughest question of all, what to do with those who fail this assessment.
And I think probably the best part of today is being able to see the amount of evidence, great evidence that is on show, looking at the amount of research that's being done into particularly education for both trainees and also younger junior doctors as well.
I came today to find out the best way to start off as a surgical tutor and trainer.
And I thought this would be a very useful conference to take some messages home. And it was a very good, nice, concise talk about what changes are happening and what do we expect.
Once we start recognising trainers, once we start rewarding what they do, then training is going to be taken more seriously. what we should be aiming towards is for a career in surgical training to be the same as a career in surgical academia, for instance. That's the end point we should be aiming for.
I think meetings like this one today have achieved a tremendous progress in this area. See the studies that have been done or being done and communicating this message to the broad audience.